Hey y'all, I hope you're good. I'm here to do a video that most have asked me to do. I have been hesitant to do it, mainly because I didn't want to keep boring guys with my fistula story, but I think I'm ready to do it now. Here is my fistula journey update. If you're new to the channel, subscribe, and don't forget to give shout outs. I'm giving shout outs this month and every other month. Let's keep this community growing and build it for us, Boo Boo and I, because this is my job. I love you guys. Where have I been, or how have I been? So I think the last video I uploaded was 6 months ago. Was the last time I updated you guys about my fistula journey. 6 months was April, not after my surgery. Yeah, I took you guys through my last surgery, and then afterwards I just kind of kept quiet on the fistula story because I felt like I just needed time to heal, to understand what I was going through, to understand the pain, to train myself to go through the pain, and then I would feel okay talking about it. So after my surgery, obviously I got the Cortex Award nomination, and I was trying to damn, I just remembered, I was trying to live life normally, to stay away from the patient mentality. I didn't want to feel like a patient forever, and I knew if I stayed in that patient mentality, I'd get depressed and I would start just sinking into this darkness that I did not want to be in, because I had already been in that darkness before. I just wanted positive vibes, and I wanted to keep good energy around my baby. So so what happened? Oh my god. So the day of the Cortex Award, I went for the award, and then the next day when I woke up, I was constipated, and I think I had something in there, and that began the most painful experience ever. I thought I'd experienced pain until that time. I don't know what I tore, I don't know what I ripped, I don't know what nerve I broke, but something happened and they could not find what it was, because there was no blood, there was nothing, but I was in pain. There was no reason why I should have been in pain, but I was in a lot of pain. So I was convinced that I had ruined myself completely, because I was okay, like I could sit properly, I could do everything until that time I went to the toilet. So I dealt with pain for about 3 more months after that. That was April, May, June, before the pain subsided. It didn't subside like 100%. I was still in pain. Going to the toilet was still a nightmare. I remember even when we were shooting the You Again film, I was in a lot of pain on set, but I just kept telling myself, Chantelle, you have to keep pushing, you have to keep pushing, you have to live like a normal person. The more you accept normalcy, the more you will heal, and the more you'll feel better. So I kept going to my doctor to check me. Nurse Phyllis kept coming to clean me. Nursing care stopped at around May, mid-May, because I couldn't afford it anymore. So basically what the doctor told me was, you can just be cleaning yourself at home with the shower head. Thank God we have a shower head here that is detachable. So basically I was just to take the shower head, spray warm water on myself around the area until I feel it's clean. There was a cream. This is advice from my wound specialist and doctor. There are creams that they gave me to apply. And then I was to go see the wound specialist every Friday still, so that he can check on my wound and just see how it is. Eventually that ended as well, because I couldn't afford it. So I've just been cleaning myself. It has been painful. I won't lie. There are days where I'm just like, hey, but I just keep pushing. And why I do is because when I see my baby, I'm just like, yo, this chick went through a lot as well at birth, and she's here smiling at me like nothing happened. So who am I to be sad and depressed because of what happened to me? So yeah, I have been pushing myself to just live like a normal person. I am taking the necessary measures to make my life easier in the toilet, as I will show you in an upcoming video. look forward to it. Now maybe I can show you guys what it took to at least get my wound to a place where they felt it's okay. She doesn't need nursing care. She can be cleaning herself. There's this thing they were using in the hospital that they used on me also when I got home, because we had bought it. It's good for such wounds. So that's what my wound specialist told me. It's called Aquacell. So basically they would cut some of this Aquacell and stuff it in my vagina. It was supposed to, what did they say it does? It's a dressing and it helps with the wound. There's something in it that helps heal the wound. Then, so after coming home and they used to put Aquacell in my vagina, they recommended that I can stop using the Aquacell and proceed to using the next thing, which was super painful. It's called Curion. This small bottle, this thing is small, like this how small it is. This small bottle is 15,000 shillings a bottle. It's a solution made out of silver ions. Each milliliter contains silver ions in the form of silver nitrate 0.01%. So they used to take the next thing, which is sterile gauze. They used to take sterile gauze. Now my nurse, not they, she used to take sterile gauze, including my wound specialist, dip it in some Curion, then she would stuff that thing inside my vag. Let me tell you, it feels like my vag was inside a -500 fridge. Like, it was cold. I felt like it was burning my cells. But apparently this thing helps speed up the healing process of wounds, which is true, because it sped up the healing process of my wound like drastically. So she would stuff it in my vag for 15 minutes. So we would just sit there and talk stories. Oh, how's your family? How are you doing today? Then after 15 minutes she removes it and applies a bunch of creams. There were like 5 creams. I think I only have 3 remaining. There were like 5 creams she used to put. Half of them were antibiotics, others were for healing and skin cell growing. And I would do that every day, once a day for, no, initially it was 3, then once. And I would do that and it would just be a nightmare. So now after I got constipated after the Cortex Awards, came the challenge. Suppositories. So now my nurse had to be inserting suppositories in my ass before leaving. Like, she would come clean me, then put a suppository, so that by the time she comes the next day I'll have pooped, because pooping was a nightmare. Like, even soft poo I did not want to, because it would sting. It was painful. I honestly do not know what I ripped. So she would put the suppository, and putting the suppository was like a nightmare. I actually would say that month, April, if someone was to look for a torture technique, that would be one of them that they could use to torture someone. You would get all the information from someone. So inserting the suppositories was painful, but she was so nice and graceful that she would insert it and then she would like talk stories with me to keep me calm and to forget the situation. So suppositories happened for like 2 weeks, and then I started pooping better. That's when I started taking this smoothie that I'll talk about in another video. Sitting was a problem. Like, I would be in a lot of pain sitting, and just life was just difficult after that constipation situation. Yeah, and then on top of that, now I'm still dealing with Summer's issues. So she had been vomiting a lot. There was a point where she started vomiting blood and pooping blood, so I got worried. We went to so many doctors. Finally we found one. That was last month, in September. We found one. She admitted us to Aga Khan, because that was the only hospital that could perform the procedure we wanted to be performed, or rather she wanted to be performed, for a baby Summer's size. So we got admitted for a week. Hey, It was hectic. Like, I can tell you for a fact, one of the most scary things to witness with your child is them being put under anesthesia. I'll never forget that feeling. I want to cry. Like, and you know, I'm there alone in the hospital because they don't allow family to visit at a certain time. So I was alone. I took her to the procedure on my own, and then they were like, now it's time to bring her. You have to sit with her while we inject her the anesthesia, and then when we give her the anesthesia, you have to go. So I'm like, okay. And I was so scared. I was not ready. So I took her to the room, and the anesthesiologist was like, okay, this is what we're going to inject her, because I'd already put a cannula on her foot. He was like, this is what we're going to inject her, and then she'll fall asleep immediately. So he's like, just hold her hand. And I looked at her. She's so tiny. She's so tiny. And then they injected her, and he was like, the guy was like, she'll feel pain. It'll be painful when it's going in, but she'll fall asleep. So I'm like, okay. So she cried so hard, like she turned maroon because it was that painful, and then she just blacked out immediately. And I wasn't ready to see that. I was not ready to see that. That was so traumatizing. I don't even like thinking about it. So obviously I had to walk out. Immediately they inject, they tell you you have to leave. Oh my god. So they tell you have to leave the room. So I left, and I pretty much cried the entire time. Like, the procedure was 2 hours. I cried the whole 2 hours because I could not get that image of my baby falling asleep that fast out of my head. Like, it's just the weirdest thing to witness as a mother. And I called my entire family. Why am I crying? I said I'll never cry on a vlog again. I called my entire family because I was so scared. Like, they don't prepare you for this as a parent. They don't prepare you for such moments in your life. They don't tell you how to handle it. No one tells you how to handle it, and you don't know what to do. You feel helpless. You can't go in the room and say, I want to sit with my baby, or I want to be there while the procedure is being done. I guess also it's not good because witnessing them doing things to your baby, you can get traumatized. So I just sat outside, clueless, not knowing what to do. I called my mom, I called my sisters, I called my friends, my best friends. And I just waited. I think that was one of the longest weeks of my life, not even when I was going through what I went through. So they did the procedure, and you know, there's this fear that sticks in your head, like, what's going to happen? You know, bad things happen in operating rooms. So I was just, all the negative thoughts I could think, I thought. It was torture. So finally, I just walked around the hospital. I'm sure some of you saw me during that week walking around the Kakan. I said hi to a couple of you. So I was just walking around the hospital, pacing up and down, and I came and sat, and they told me, okay, you can go. Your baby has been removed from the room, from the operating room. You can now go sit with her in recovery. And I came and just looked at her, and I'm like, you're so small. Like, you're so small and you're so strong. Like, you're going through all this. Why? And I didn't know what to do, how to hold her. She was very deep asleep. There was blood all over on the bed because part of the procedure, whatever they put inside, she was doing an endoscopy and biopsy to see what's happening with her. Obviously they put a tube, so the tube causes irritation, so you're bound to remove some blood from your mouth and from your anus. So there was blood, like she had a bit of blood, and then they had to put a oxygen tube in her nose. at some point to help her breathe, because the tube creates pressure. The camera tube, the one for the endoscopy, it creates pressure, so the child will need help breathing because it's finyaing the lungs. I guess that's what the doctor said. And then also there was blood in her poop now a lot, because they also had to do a lower endoscopy through the anus to just see what's happening with her insides. So they did, the procedure was successful, they did the biopsy. So I'm sitting there with her, and then she woke up, and I just looked at her. I was happy that she woke up. I held her, and then they took us to the room and we stayed there. My family was there at that point, my mom and my sister. No, my mom, she came. They did so many tests on her that week, so many. They did brain tests, they did the endoscopy, they did heart tests, everything. And I'm just thinking to myself, wow, like, even genetic tests, allergy tests. There's one test they could not do. It was expensive. It was 176,000, so we didn't do that test, the specific genetic test. I managed to get insurance, but they could not cover that test because we were under a waiting period. Even the hospital stay, they had refused to cover me. And by the time the doctor was discharging us, the bill was 600,000. So I was like, now I've already done a fundraising pay bill for the beginning of this year, and now here is another 600,000 bill, and I've paid this insurance all this money to avoid a situation where I am starting another pay bill, because I don't want to do that again. And now they're telling me they can't cover my hospital stay. So I'm like, guy fafa. So I start thinking to myself, so all this stress is happening at once. Still taking care of Summer. My body was in pain at that point, because at the hospital you stay in the children's ward with your baby and they give you a couch to sleep on. My body was in pain, and then now insurance is telling me, sorry, we can't help you, like, sort yourself out. Hey, I went on Twitter, I complained, I tagged the insurance. I was ready, like, I tagged them and I said this is not fair. Eventually the owner of the insurance company got in touch with me and he helped me out, he sorted it out. But we still didn't do the genetic test because we're still under the waiting period. Not even waiting period, they don't do genetic tests under insurance, I think. Yeah, so yeah, that's where we're both at. How is my healing? I'm so sorry I cried. How is my healing? My healing, I would say I'm 80% there. I'm actually supposed to go see my gynecologist next week. I've just been postponing because of funds, but I know I'll be able to go see him next week. So far, pain wise, like, I'm trying. My smoothie is really helping me. It helps me go to the toilet easily, and also I'm watching, like, I'm just trying basically. I'm 80% there. Mentally, it's still a struggle. Sometimes I get flashbacks and I just switch off. I just switch off completely. But I'm getting there. I think the healing that is going to take time is the mental and emotional healing. Physically, I might be 80%, but mental and emotional, I'm very still traumatized. I'm still very traumatized by the experience. And every day something happens to just remind me of it. But we're taking it a day at a time. I'm doing the best for my baby. Thank God I found a good doctor now. Her name is Dr. Washeke. She's a consultant at Aga Khan. She's really good. My namesake. She's really good, and she cares for her patients, and she tries to do the best to know what is happening with your child, which I really appreciate. And she understands and listens. Like, if you tell her, hey, me, I'm low on funds, how can we do it in this way, she'll help you figure it out for the best for your baby. Yeah, I don't know if I've left anything out, but that's how it's been the last 6 months, just in and out of hospital, going for checkups for myself and baby, being admitted, crying a bit, but it's a day at a time type of thing. It just doesn't go away immediately. Like, you just don't heal immediately from fistula. You don't just heal immediately from birth trauma. It takes time. Pray for baby and I. Some days are rough. I know it's also taken a toll on my family, not in a bad way, but I know we are all tired. Like, we have all been putting our all in this whole situation. So just pray for us, ask God to give us strength, and yeah, ask God to give me strength and patience and understanding, and what else? Just grace. Thank you guys for watching the video. I'm sorry I got emotional. See you next week for another episode. I hope this has given you an update of my fistula journey and where we are both at with baby. Yeah, I love you guys. Mwah.